we picking our own music? What's happening?
Music. Like, where's the wine and cheese?
What? There's a lot of people in here. Huh? Why are you talking to me like over people? He's gone somewhere now. He'll be back out there at 3:30. If you want to see him, should be. Nick's picking. I was telling her you missed Nick for lunch. We got 3:30. Wrap this thing up by 3:30.
No, look, it's as long as we want to talk.
We're not gonna be here all day now.
Of course you are. Rebecca. this music is kind of sexy for a seminar.
All right. It is 2:25. That music, y'all. I'm like, where's the wine and cheese? We're going to start it right at 2:25 because I know people got to travel, and I know if you're just eating. So let's get it started. My name is Maya Carter. I am the Operations Systems Support Director for Georgia Medicaid. I see people are still trickling in. So I'll start with something funny. A little too real for me, but I'll let you all laugh at my expense. We need laughter. When Brian asked me to present, I got excited because I haven't done it in a while. And as the policy people, this is our chance to see you and see your faces and meet the people that we're on a dozen emails with and Teams calls. So I got excited. I went to Ross Dress for Less. I bought me some clothes. Okay, I got my makeup on. And so here's where it got real. I went to Ross, and the checkout dude, younger guy, he's got like tattoos on his arms, beard. So I'm like, he's hip. I'm hip too. He's hip like me. So I get to the counter. I'm doing what I think is hip small talk because I feel like I'm on his level. And he rings my things up, and then he looks at me, and he says, "Are you 55 and older?" And I was like, no one's ever asked me that, and this is not the liquor store. What is happening? And then he said, "Well, I thought so, and you should know that today is your lucky day. On Tuesdays is Senior Citizen Discount Day." So I took the discount, And I walked to my car and I had 2 reality checks. Number one, ladies, Ross Dress for Less does 10% off on Tuesdays if you're 55 and up. And the second one is, I am an elder out here in these streets. I am a whole senior citizen and I'm not all right. So, okay. So, we'll get started. The name of this session is called Billing Basics, Denials, How Policy Changes Impact Claims. But we can talk about whatever you want to talk about, okay? Because I know we got a lot of different kinds of providers. I'll answer whatever I know. What I don't, I'll hunt it down. Uh-oh, what did I break? I promise all I did was push the right button. A senior moment already. See? Time is slipping. Okay, there's our purpose, as you've seen 45 million times today. Ensuring that our Georgians are well taken care of, their services are provided well. That's what we are about here at DCH. Here's our agenda. We're gonna first go through staff introductions. We're gonna talk about common denials, AKA the main reasons why your claims deny. The process for rate increases. And I chose that because it takes a long time and y'all don't play about your extra money. Y'all want to know how long is it gonna take me to get that extra $1.75 for the service that we just got approved for. Policy manuals and the importance of contacting your field rep, knowing who your field rep is, making sure you're utilizing that resource, and then we're gonna do Q&A. All right, staff introduction. Today, I'm being assisted by my trusty Gainwell team, Chantel Bradshaw and Tiara Johnson. They had to stay on me about getting my draft of this presentation together, and they were not playing with me. And not listed on here, I must say, because he's front row, and he is like the best supervisor, deputy director ever. Mr. Brian Dowd is here in the building. He's who every employee deserves as a boss. And then I'm Maya Carter, and I'm the director of the Operations System Support Division. This is a unit that was built for the purpose of kind of like being the interpreter or the liaison between what's happening in your world and what's happening in GAMIS. So whenever there are changes that need to be made, my team spearheads that and facilitates those changes. Marilyn Ellis. Marilyn is my right hand. She's the right side of my brain. She's my whole brain sometimes. She knows like way more than me. So I don't get to do half of what I do without her help. Marilyn Ellis, stand up, let them see you. I know you've heard her name. And Evelyn Grimes, she's not with us. She's back in our building on Thursdays. That's our required day in office, holding down the Fort. Evelyn Grimes. All right, common denials. I know we got, I looked at who was here. We got a lot of waiver people here. We've got some, let's see, case management, CCSP source, children's intervention school services. We got some DME people here. So some of these denials that I'm gonna talk about may not necessarily be what you see on your claims, but according to Gainwell, they ran a query to show the top denials, and I'm listing here the top 10. The top 10 reasons why claims deny, and here's a number of claims that deny for them. And some of these are things that your billers are just making mistakes on, not paying attention to, hitting the submit button too soon. These are things that, not calling anybody out, because, you know, I promise, I screw up daily. But this is just so you know, things like member ineligible on the date of service. Did you check eligibility before you submitted that claim? Better yet, are you checking eligibility before you render the service? Make sure your members are eligible. Sometimes they don't know they're eligible. So it's on you to check before you render that service. We got a lot of drama going on with drug codes, NDCs. 4801 is one I see a lot in the behavioral health world. Any 440 providers in here? Any behavioral health providers? Okay. That usually occurs when you're trying to bill for a procedure code that you don't have. And sometimes I know billing staff turns over, especially in CSBs where it's a lot of people. Just because you're in 440 does not mean you get to bill every single service in 440. You get to bill what you've been approved for by DBHDD. And when you have billing staff that turns over, sometimes people don't know that they're not approved for that service. So always check your approval letter when you are submitting claims. And if you do find that you're supposed to have a code that you don't have, contact your field rep. And they will usually double check with us or DBHCD to make sure, and we can do rate loads almost instantaneously. Exact duplicate, suspect crossover duplicate. That means y'all are working too hard. Y'all submitting claims twice, okay? So check with your coworker. Did you submit this claim for her yet? Okay, don't do that again. PA procedure code requires a PA or research. Where is your prior authorization? Did you put it on the claim? Did you put it in the right field on the claim? Those are things that happen, simple corrections that you can make that will help you make your claims adjudicate correctly the first time. All right, process for rate increases and mass adjustments. This happens whenever CMS says, hey, we're going to give autism a 3% rate increase across the board. Or we're going to do a 2% increase for now and comp providers. It sounds simple, right? Just add the $4.73 to the price and pay us. It's not that simple, I promise you. All of this has to happen with a rate increase or a mass adjustment. And the reason why I wanted to take the time to explain to you is because right now we are still doing the now comp rate increase that occurred, that became effective July 1st of 2024. We're still trying to apply that mass adjustment. These are the things that have to happen. Depending on how claims price is the big deal here. For providers that price off of the provider rate file, those are pretty easy. That means the dollar amount is linked to your provider ID. So we could just simply make a rate update. That's why the autism rate increase got done so quickly. But for those programs where the price is linked to the PA, it's a whole situation. Not only do we have to update forthcoming PAs with the new rate, we have to go back and change the rate for old PAs that are covered by the rate increase effective date. And some of those span from the old rate to the new rate. And all of that work has to be done in tandem with other agencies, our PA vendors, our Gainwell team, DBHDD, Alliant, DCHIT, and policy. And it just takes a long time because we have to do it carefully so that nothing gets processed incorrectly. In addition to the dollar amount that has to be changed, you have to change any edits and audits that have a dollar limit. So if you have an edit that says don't pay this claim if they're billing for more than $500, but the rate increase is now for $550. So we got to change that dollar amount on the edit and audit so the audits don't post at $500 anymore. It's got to post at $550 now. So all of that has to happen. Once that's done, we do what's called a mass adjustment. A mass adjustment is we say, okay, all the changes have been made in GAMUS. Let's go back, find the universal claims that already paid the lower rate, switch that up, and put it out in production so that the providers can get the difference. And sometimes these universes can be 2 million claims, hundreds of thousands of claims, and they have to be released in phases. It's a lot of drama. So, but I just wanted to let you know that's what takes so long sometimes. And then the policy manuals have to get updated, making sure the right amount is listed in the policy manual. And banner messages have to go out to let y'all know what's going on. So it's a reason we're not just sitting there twiddling our thumbs. It's a whole process. Speaking of policy manuals, Does everyone here know you have a policy manual? Okay, you have a policy manual for your program. You have a part 1 policy manual that's kind of like the mother over your part 2 that shows you what the laws and the policies are with regard to just being a provider for Medicaid. You also have like billing manuals. HCFA 1500, UB institutional claims. Those are manuals that should be what you should be familiar with. Peruse those manuals. They are updated every quarter. A new manual gets posted on the 1st of every quarter. Even if the only thing that's changed is the date, a new manual gets posted. And sometimes the link to that manual changes. So it's important that you go out on the 1st of every quarter, make sure you access the newest version of your manual. It is our primary method of communicating with you. Policy manuals and banner messages. That is how we talk to you. That's how we let you know what's going on. That's how you find out that code combination that you used to build together all the time. CMS said stop that last quarter, and so now you got to do it a different way. Check your manuals first. A lot of times when things are denying or you're seeing different trends in your claims, it's because of something that has been updated. Anybody, let's go to church, y'all. Anybody got an empty seat next to them? We got some people trickling in from the back. Put your hand up. And it's hot in here. I know. I see y'all fanning. This is church then. It's hot. You got a church fan. Okay. Also, CMS enforcements, the way CMS holds states accountable, those policies and those regulations, we include them in our manuals. They are in the Part 1 manual. It's important that you review your manual so that you can make sure your stuff is together and you're doing things legally and lawfully. And it's also the same tool that auditors use when they come to audit you. So you don't want to get surprised by an auditor for something that was in your manual that you didn't look at or that you never noticed was there. All right. Contacting your Gainwell field rep at Gainwell Technologies. Contacting your field rep. How many of you know you have an assigned field rep? Okay. How many of you know how to contact your assigned field rep? Okay, I see some hands not up. All right. First of all, read your remittance advice. When you get paid on Mondays, there's a remittance advice that will tell you everything that paid. It'll tell you everything that denied and the reason why it denied. Some of the descriptions of the codes can be a little confusing or you don't understand the language, but some of it is plain as day, like member not eligible on date of service. Always read your remittance advice so you can know how to correct your claims. Contact your assigned field rep first. That's your first line of protocol. I see you with your question. I'm gonna come to you first, but if you can hold your questions until after we done it, I promise you I got like 2 more slides. Okay. And I'm saying this really for myself and for Brian and Rebecca because we tell y'all that, but if you get us on the phone, we usually answer your question for you. But you should let your field rep know first. You should attempt to contact your field rep. You can use the Contact Us feature in the portal. That's the quickest way. And the field reps don't play about getting back to you. Sharana and her team, don't let Danny Williams find out that you got a question because he is like on the phone with you immediately. He's sending you screenshots and all of that. So contact your field rep. If you have issues with contacting your field rep, you can let me know. You can let Sharana Strong at Gainwell know. If your field rep does not know the answer to questions you have or there's an issue they can't correct, they call us directly. They will hunt us down, and at that point, it's our decision to find out what's going on. But you really, really should utilize your field rep. Get to know who they are. Make them your friend. And that's all I had in terms of the presentation today. I told you it was gonna be quick. So again, my name is Maya Carter. I didn't put my email address, so I'll tell you what it is. It's mcarter@dcha.ga.gov. Again, Maya Carter, Maya, mcarter@dcha.ga.gov. So I'll let Chantel, and I'll let y'all got a presentation. Okay. All right. It's important that you speak in the microphone for any questions you have. I'll respond in the microphone. They're recording this so that they can put it out in the presentation on GAMUS. So if you have questions, raise your hand and we'll bring the mic to you.
I think so. Going around? Okay.
Okay. Questions? We got one up here. Okay.
Yep.
She's next. Yes.
Yes. How do we find our field rep? We don't know who it is or where to go to find them.
Okay. You want to do it live? You know? Okay. Okay.
So I'm a field rep. My name is Chantel Bradshaw. I'm the field rep for Territory 6. As Maya was stating earlier, you will need to log into your web portal account. It will go directly to your field rep per that location. In all of our presentations, we do have a list along with the map of all the field reps and territories.
Hey, so I work for an ear, nose, and throat, and a lot of times when we send over a claim for a Medicaid secondary, if it's a Medicare Advantage plan, it'll always go over as commercial, and I understand it's the same payer ID. Is there something on the front end that we can change to fix that so we don't have to manually go in for every single claim and fix those?
Yeah, you shouldn't have to. When you say go in on the front end, I'm assuming that means you're logging in with your assigned provider number and you're submitting your claims.
No, we do it electronic.
Ah, so it's something happening in your clearinghouse. So you definitely need to get in touch with your field rep. Okay. They have a whole EDI department on Gainwell, and that's what they do. They get down in the weeds whenever there's a situation like that, and your field rep will help you do that. If you give me your information at the end of this, I'll make sure that your field rep will expect your inquiry.
Okay, thank you so much.
Mm-hmm.
Hi, I have a question. So, as of 10/1, a lot of the billing codes changed for, let's say, a person was diagnosed with high blood pressure, just as an example, and the code is now changed, but the PA that we received was always I-10. What do we do about that?
What program? What category of service?
It was Source.
Okay. The diagnosis code changed or the procedure code?
Well, what I mean by that is, let's say it's no longer, like an ICD-10 code is no longer billable.
Mm-hmm.
I've been running into that a lot lately, where ICD-10 codes have changed.
Was it an unspecified diagnosis code that you were using before?
Yes.
Okay.
But
So,
now they don't. A lot of people back here are saying they're running into the same thing.
okay. And so, Brian, I'll let you jump in if I'm missing anything. CMS will decide that this unspecified code, diagnosis code that you used to use, we need you to be more specific. We need you to pick a diagnosis code, a valid diagnosis code that's more specified. And so a lot of times those diagnosis codes, the file that we receive for diagnosis codes comes from CMS, and they will make changes on that file. That file gets automatically loaded into GAMUS, and what used to be valid is no longer valid. That is something that we have a team, and we work with Gainwell to anticipate and so that policy can be notified that that change is made, but sometimes it doesn't always happen.
Yeah, what Maya said, but we started, so in 2008, we did a massive campaign that told providers you can't use unspecified diagnosis codes. And I know it was 2008 because on my desk at work, I have a list of things to do pad that we were handing out to people. And on top of it, it says you cannot use unspecified diagnosis codes as of October 1st, 2008. So there were obviously some unspecified codes for diagnosis that we had out there that hadn't been caught up by the federal government yet, and it sounds like those have gotten caught up. Now, y'all know I used to be the waiver guy. You need to go back, if it is unspecified, and you've been doing a level of care this long, you should have a specified diagnosis code. It's the keep it real portion of the presentation, y'all. Why do you still have an unspecified diagnosis code for a member who is receiving your service and doing a level care year after year after year? You should have, don't give me unspecified dementia at this point. Unspecified back pain in year 4 of the program? So, and let me also be clear on how this works. You only have to have a valid diagnosis code. I look at a lot of claims and there are 20, 30 diagnosis codes on there. You just need one that is valid and not unspecified to go through. Am I lying? Somebody tell me when I'm lying.
Hey, Brian.
Yeah.
You are so true.
Thank you. So I just want to make sure we're all on this page. Hey, you need, so if I was a case manager in Source, CCSP, ICWP, and or now in comp, and that was coming up for me, I would be going back to my authorizer, my person who did the DMA 6, the 5588, whatever the level of care instrument is, and saying, hey, I need a specified diagnosis code on here so that I can build this, and so CMS isn't going to come back and take back all this money from all of us. Because it's not, I know a lot of times when Maya and I or Rebecca or whoever here tell you something, I know the inner dialogue, because I've been doing this a long time, is, man, they get on my nerves. They just try and find reasons to deny you. No, we're trying to keep your money in your pocket. Because if you don't follow the things that Maya was saying here earlier about CMS auditing and auditing, we will take your money back. Because the federal government takes that 2/3 from us. So we'll just reprocess your claim back. So we're really trying to ensure that when you have a perm audit, or when you have a state-sponsored audit, or God forbid an OIG audit, that your ducks are in a row and you're not just using something because you didn't know about it and couldn't have gotten it taken care of. Oh, they started the edit on the header codes as well. Okay. Next question, sorry. I kind of went off on that one.
Yeah, I almost forgot my question.
No, I'm going to leave mine now because she's doing a good job.
Okay. I almost forgot my question, but at the beginning you were talking about with your contract you would get your rates and all those things, but we never received a contract. We called and they said the SciCall manual is our contract, and when it comes to those rates that are there when we bill them, they say we can't. So we've been having some issues with that because we never really received a formal contract. We received a letter that said that we were credentialed, but no contract.
What's your category of service?
Behavioral health services.
Okay, so you went through the whole enrollment forum, and you submitted your packet, and DBHDD sent you a letter that said you were approved to be an intensive family intervention services program provider or a core.
We are a behavioral, well, we're under DCH. We're not under DBHDD.
You're in psychology and therapy service.
Yes.
Okay,
psychology and
so you're the
therapy.
psych.
Yes.
Yes.
Okay.
So
Let me help. Sorry, Mike. So there's two this is a great question. There's two different phases, y'all, to becoming a provider. So when you enroll to be a provider, right, and you go through Rebecca's unit of provider enrollment, boom, you become a provider. Congratulations, you can bill fee-for-service, right? But fee-for-service is the smaller end of who we serve. The larger end of who we serve is through the care management organizations that are over there. So what happens is we don't contract with you. You just become an enrolled provider. There's no contract. You're an enrolled Medicaid provider, and your job is to follow the policy manual. That's how it works in fee-for-service. And your rates are in the manual for your program. All the codes and the rates are in your individual Part 2 manual for psychology and therapy services. And that is what it is. There's nothing more there. In order to serve the CMOs, you have to have a contract with the CMOs.
Which we do.
Okay.
Yeah.
So you should be able to bill for whichever the CMOs are or what fee-for-service is.
Well, and they say their rates are the same as DCH's rates, but they're not. They're less. So it's like we're trying to figure out what are we referencing here. It's like somebody can give us a rate over here, but they said this is supposed to be our rate.
Yeah, so that's another great question.
Yeah.
Because I don't know how many of y'all contact me with a complaint about the CMO rates. And I say the same thing every time. What's in your contract? I didn't negotiate your contract with the CMO. You did. So if they're not paying you what's in your contract, you need to tell them they're in breach of your contract.
Well,
So go back and talk to them. And you're talking to the fee-for-service people about
got you.
CMO.
Yeah.
So I'm not trying to cut you off, but you got to direct that to the proper place.
It has been, and they direct us back to DCH policies. Everything falls under you guys, not them.
Okay, so we have a dedicated email address, and people here, Shanique Horn, who is over the oversight of the CMO operations. If you have gone to your CMO and the CMO, you have a contract and they're not honoring the contract, right? Then you should be contacting Shanique Horn and the CMO unit for that follow-up. It's under Maxine Elliott, which is another deputy executive director like myself and Rebecca. And that's who you need to go to. And there's a complaint email that's specific to CMOs. It's like MCD complaints or something?
It's MDC something.
It's
Probably on our website.
It's on our website under managed care, where you can also go and then it gets logged and put in.
And they have like 72 hours to respond once they receive your complaint, or once our compliance person says, "Hey, AmeriGroup, we got this complaint about you. We need someone to respond." They have so much time to get back to you.
Yeah. Because if your contract says they should be paying what's in the fee-for-service scale, they should be paying what's in the fee-for-service scale if they contract you. And by the way, for those of you who get rate increases, like Maya said before, like you'll call me or Maya or Rebecca and you'll say, hey, you gave a rate increase in autism of 3%. Do the CMOs do that too? You will hear me say, I don't know what's in your contract. Does your contract say they're going to pay what the fee-for-service rate is? If so, then I would be asking where my 3% is, right? Because we've given a 3%. But if your contract says something like the rates based on 2010, then I can't help you because that's what you negotiated in your contract. Next question from Maya and I and Rebecca and Nay and anybody else I pull out of the audience.
I have a question.
Who is that person? Hey.
Hey.
Okay.
Good afternoon.
Good afternoon.
My question is, I'm asking in the place of a new biller.
Right.
Does Gamewell do any type of training to show you how to fix these denials? Some of them are easy. Some of them are easy. You know, when it says it's they already have a CMO. All those are easy, but it's the more detailed ones and how to fix them because I'm fairly new to it, but I've never known of a training. I'm over here.
Oh, here.
Yeah. I don't know about a training on how to fix it,
Right.
how to read these.
Okay, I'm cutting you off because rest at ease. We got you. Okay? Your field rep is assigned to you, and that is their job. They are responsible for contacting you over the phone, email. They'll set up a webinar, or they will come to your door, sit with you, and watch you push the send button and teach you how to submit everything closely. That is what they do.
Tell them about the periodic trainings too,
And they also have periodic trainings where they will pick a topic and they will train anybody who registers. I think it's monthly. Or if there's something, you see a bunch of providers that are experiencing the same issue, tell them. They'll create a webinar around it. But that's exactly what they're responsible for doing. So you need to just reach out to your field rep, log in through the portal, click the contact us button, and your assigned field rep for your region, that contact information will be there. And they have a 72-hour turnaround requirement to get back with you, but I promise you, they usually get back with you same day. Even if to tell you, I got your inquiry, I'm gonna call you tomorrow. They'll set up a time to reach out to you. Some of the training is on our website, on the GAMUS website that you don't have to log into. Just the plain mmis.georgia.gov, provider information, provider notices, announcements about training, information about or previous trainings about PAs, all of that stuff. There's a whole information and education drop-down menu that you can access at any time.
For reference, I'm a CIS provider, but periodically there must sort of be some sweep where all of a sudden OHI is added to a member's eligibility. So at the bottom, of the page when you're checking member eligibility, you can see other health insurance if the child has a primary. Oftentimes, probably more often than not, the information is incorrect. Old policies have been pulled that the child was on before. It's maybe not even a health insurance policy, it's a life insurance policy. This affects not only fee-for-service, which I know was what you're talking about, but this is across the board for Medicaid members. We encourage the families to call, try to get the information fixed. It oftentimes takes more than one phone call. What is the best way to get that rectified? How does that happen? Because it really does cause disruption with billing.
So there is. That does happen. As the person who used to be the TPL guy many years ago, we do periodic sweeps of seeing if they have private insurance, because since it's taxpayer dollars that pay, we're always the payer of last resort. There is a form that is online, and I can't, and somebody said it in my early meeting this morning. Thank you. There's a DMA 410 that you can fill out and send in, and it will rectify that if it's an old policy. Go ahead, you talk. Come up here, come on. Come on. You have me saying stuff that's...
So like he was saying earlier, it's a DMA 410, which is commercial side. On the member eligibility panel, there is a member transaction button. You can actually upload that form there, and it will go over to our TPL department to verify and update. So that is the quickest way that you can have that information removed from the member's file. And if it's a Medicare, is another form, which is a DMA 460, which does the same as that thing. It verifies the Medicare benefits and updates the member's file.
And so does that 410 work for a child that has fee-for-service and CMOs?
Yes, because everything has to be updated in GAMUS to trickle over to the CMOs.
Okay.
So the 410 will work.
And that form can be uploaded again to
When
GAMUS?
you go to the members eligibility tab, there's a section called member transaction. It's a blue button. You would click on it and you would just upload. It says EOB upload.
Okay.
If I'm not mistaken.
And you can upload there for, again, fee-for-service and CMO?
It has to be updated there because,
Okay.
again, it's updated in GAMUS and it will go over to the CMOs.
Okay, thank you.
You're welcome.
Hi, I had a question coming from medical. When a commercial plan reprocesses a claim, say a year later, because we know that they love to do that, and the Medicaid is secondary, and then y'all deny for timely, and then we send in the EOB to support, hey, they just reprocessed this, and then y'all are still denying it.
Let your field rep know.
Okay.
We will override timeliness when the late submission happens because and it wasn't your fault.
All right, so more information added to that. All right, so
That's
say
Danny,
for-
y'all. That's Danny Williams.
All right, so
He's
if you
like super field rep. All of them are good, but he's like got a cape on and an S on his chest.
All right, so say for instance you receive a recoupment from United Healthcare, right? Whatever that recoupment is, whatever the case is, say for instance it's non-covered for United, and that's why they recouped it, right? That EOB date that's on that EOB for the recoupment, you have to upload it to your new claim that you're going to submit again to Medicaid, and then you have 90 days from that recoupment date to get it into us in order for us to override timely filing. You will have to tell your field rep this is a new ICN that you just submitted with the EOB that indicates the recoupment, and the field rep has to actually manually process that claim for you. Does that make sense? Got it? Any questions? All right.
See, and y'all say we're not here to help.
Hi, good afternoon. I'm actually asking a question regarding open session this morning from Mr. Gerard. He had mentioned that basically reactive payment is going from 3 months to 2 months. Is that happening, and when is that going to be effective?
So that was part of HR 1, the whatever, that big, beautiful, whatever they call it. That was part of that legislation. I can't remember the date. I want to say it's 2028. But forever, like I've been doing this 28 years now. I started as an age blind and disabled Medicaid worker at DeKalb County DFACS doing eligibility. And since that time, you walk in the door today, we should be saying when we determine your eligibility, do you have any bills from 3 months prior? Right? Because I can go back and, what month is it? November? I can go back, look at October, September, and August. Well, once that time frame hits from HR 1, we'll only be able to go back and look at 2 months prior. But that's not till, I want to say it's 2028. It may be 2027.
Thank you.
It's what? It's earlier than that?
I thought he said 26,
Oh,
but
maybe it is 2026. If it is, we'll put out notice before then.
okay.
We'll put it on your RAs. We'll do a whole notice process with it. We're really waiting on a lot of those HR 1 provisions to get what's called a state Medicaid director's letter, which outlines for us the individual steps. So that's why we haven't put out specifics yet.
I appreciate that. Thank you.
Yeah. What else? I don't see any more hands. People want to drive home. I got to go to Gwinnett. And I need to stop by the DeKalb Farmers Market on the way. So I'm not pressuring anybody, but I don't know how many of y'all shop at the farmers market. It gets busy in the afternoon.
Hi,
Yeah.
I'm Stephanie. I'm with Pruitt Health. We do long-term care skilled nursing facilities.
Yep.
So we work with Carolyn. She's absolutely incredible. We love her. She's awesome. She always answers our questions. So we've been instructed to, the way that we proceed with timely filing override requests is to submit an appeal, a DMA 520 in GAMUS, and then submit for either admin review or the appeal. We are consistently advised that there is no turnover time on those. So we're just kind of wondering if there is any like a nudge, because we've got some like really old stuff that we're like waiting to get some feedback from to kind of figure out like where we went wrong, you know, what we need to do better in the future, and if there's something that we can submit within that appeal to potentially make it move faster.
Yeah, so this is for skilled nursing facility. It's a nursing facility.
Correct,
request
yes.
claim? Who does that now? Who's the
I was
nursing
gonna say, like,
facility
the
person?
vast majority of our AR at this point is just waiting on admin reviews.
Come on up here. Introduce yourself. Come on up, nursing home person, and introduce yourself. You know, I don't know your name, and I'll work with you. You'll be all right. These people won't jump you on your way to your car. If you will, they're soft. You can take them.
I might be more new than you.
Hi, everyone. My name is Brittany. I'm the long-term care specialist. I just started, so I may not be able to answer your question today.
In a nutshell, you're trying to figure out what's the turnaround time for when you submit that.
Or like, what is the amount of time before we are kind of like, hey, what's going? Oh. It's up. Okay, cool. Nice. We're back.
We're going to need like specifics on
Okay.
what you're waiting on, and you're going to have to send that in to Brittany. She's not in my unit, or
Okay.
I would know who Brittany is.
And
And
I've worked with Brittany. She's helped with. We've had some unique situations that we've brought to her that it's been like, oh my god, don't know what's going on with these, but it's just the timely filing stuff that's just been.
send us in some examples so we can track down, are they just somebody's looking at them, or do we just need to give you feedback as to whether or not we can override the timely filing on that?
Really, we
Okay.
just want to know whether or not you're going to be able to override the timely so
Yeah.
we can proceed internally.
Gotcha.
Okay, excellent. I have.
I didn't mean to call you up here, Brittany. Yeah, you'll be all right. You'll be okay. Now we're all up here, see? Don't think I won't call you up here to stand with us.
Okay, so I have I have another scenario that is very unique where I have a resident who was approved for an IME because they were over resources. There was a lapse in communication between my biller and the facility over the approval for the IME, and we were paid anyways. So how would it be another unique scenario I would just kind of reach out to you about?
Yeah, you're going to have to do that.
Okay.
Like for one-offs, you have to send it to the specialist.
Okay.
And then they can get with the field program specialist or anybody else to give you guidance on it.
Okay, so no like 501 and then appeal
No.
for that. Okay, excellent. All right, I'm done.
You can go.
No, she was she's fine.
Thank you, Brittany.
Oh, okay.
Thank you, Brittany. It's nursing facility, so it won't. As long as there's a level of care in there, it'll go ahead and process. No, Brittany was so scared. Let's give a round of applause for Brittany. Anything else? I didn't mean to pressure y'all into stop asking questions. I was just joking. Any other questions?
Hi, one of my team members has tried to get a parent to contact Medicaid regarding a date of birth discrepancy. Parent said she called, she updated the information. We're not able to push those claims through because of the date of birth. What would be the best course of action for this case?
So I'm gonna give you a couple of things here, and this is an important thing for those of you who are out there in the world. We get our demographic information in MMIS from one of two places. If their Medicaid was approved by DFACS, if their LIM, RSM, pregnant women, nursing home, hospice, something like that, DFACS needs to update the date of birth on their end so that it comes to us. Now, any of us who have GAMUS access can go in and update the date of birth, but if we do it, we run a quarterly recon file, and it will just mess up again if it's not fixed in the DFACS system, which is the source system. And Bradley was out there earlier in the little vendor room, Bradley from DFACS, helping with just these issues. Now, here's another thing. If that individual, child or adult, has SSI, you can contact DFACS till you're blue in the face. And DFACS cannot change that, because individuals who receive supplemental security income, their information comes directly from a feed from the Social Security Administration, whether it be address, name, date of birth, gender, whatever. You gotta go to the Social Security office. They're working again. Go get in line. So if it's SSI, right, you have to go there. If it's a normal, what I think of as medical assistance case, you have to get with DFACS. And if they've made multiple contacts with DFACS, I'm an old DFACS worker, so I can say this. Y'all, there's a chain of command at DFACS. If it's just like, if you go to McDonald's and they give you a bad hamburger, you don't go, well, I guess I'm gonna take this hamburger and go home. If you say something to a person, if they go, I can't help you, like, I know there's somebody else who runs this store besides this 16-year-old. So you ask for like a manager. So there's supervisors, there's county directors. They have their own field program specialists within the county who oversee regions as well.
Thank you.
Yeah.
We were looking for clarification on the denial of Medicaid secondary claims for Medicare Advantage plans, like at the beginning of the year when deductibles are due and the primary plan does not pay, but they do allow and apply it to the deductible. We are in nephrology, so we have a lot of ESRD patients that have Medicare Advantage plans. At the beginning of the year, their claims are not paid because the deductibles are due, and Medicaid does not pay those claims, and it will say the primary payment is missing.
Yeah, I'm honestly not sure on that one because I don't do that Medicare crossover.
Danny, did you catch that? Well, let me ask this. So you're saying what you're billing for, it's known that Medicare or Medicare Advantage does not cover it?
It's
part
covered,
of the deductible.
but no payment was made because it was applied to the deductible. When we go to hard key some of those secondary claims on GAMIS, Medicaid will still deny the claim saying that the primary payment is missing. And because it's a zero payment.
Send that to your field specialist, and you're attaching whatever the attachment is that shows, that proves that you submitted it to them first?
We just learned how to do the attachments at a previous session. However, we're hard keying all the information from the primary EOB onto GAMIS.
Okay. Try, since you just learned how to submit the attachments, if it's still not going through, call your field rep.
Thank you.
Yes. Oh, sure. Let's her come get a microphone.
My big mouth. Hi. First of all, your Medicare Advantage plans are treated just as traditional Medicare. So when you submit those claims through the system and you receive that denial, our system is looking at it just as traditional Medicare. If you all recall, in June, we did a major recoupment, right? No? Yeah? Okay, well, we did a major recoupment in June with the secondary claims because providers were submitting the claims over saying that either Medicare made a zero payment or it was all being applied to the deductible or the coinsurance, and there was no EOBs attached. Without that EOB being on there, when the audit was done, they were not able to identify what you had, and the majority of them we did find out when providers resubmitted them. They resubmitted them incorrectly. So the process was put in place to where when I was a rep, I would say process of elimination. When you're dealing with Medicare as a primary, traditional, or Medicare Advantage, always attach that EOB with that claim, and you won't run across that.
And tell us your name.
Cynthia. I am Janie Griffin Weaver.
See, all you gotta do is ask. You gotta do is ask. That's why this is important. Sometimes we have to take away and find it, but sometimes you can get whatever it is addressed right here. Any other questions? We got someone over here to your left. Yeah.
Is there a reason that Medicaid does not like the 76 or 77 modifier for an EKG?
Does not like?
Every time we try to bill an EKG with a 76 or a 77, it gets denied.
For what?
Usually as a duplicate or as bundled.
So that's probably we get these questions a lot. Like, there's no day in my life where somebody doesn't contact me and say, "Why isn't this code covered? Why can't I use this modifier? Why can't?" Well, it's probably the history of it. That modifier is probably bundled into the rate calculation for a different code. But I can't tell you that for sure unless you send in that question to us, and you can send it in to me, and I'll get one of our medical policy people to look at it. Or send it into Maya, and we'll get one of our medical policy people to look into it, and then we can give you the history of why it's not there.
Okay, and then in the hospice modifier for the GW, most of the time, if it's a Medicare crossover, we have to remove the GW modifier from the claim in order to get it paid.
Yeah, Medicare doesn't.
They don't take.
I don't think they.
I know they don't accept modifiers for a lot of programs. I'd have to double check to make sure it's yours, but they don't accept our modifiers.
Okay.
So you can put that in the same email, and we'll confirm it.
All right, thank you.
Yeah, of course. Anything else? Going once. Oh, we found somebody.
So I work for a large practice. We have about 90 locations from Middle Georgia north. So we've had some confusion on who our provider rep is because we have locations in pretty much every territory except for deep South Georgia. So if we're trying to reach out to somebody as far as who our provider rep is, are we just going based on which territory that particular location is in? We may have a provider that works at 10 different locations and floats around, and it may cross between territories, so we're kind of bounced around all over the place.
The assigned field rep is usually connected to the rendering provider ID for the claims that you're submitting. Okay. So whatever ID you're logging into the portal under and submitting claims with, that ID is connected to a specific field rep. So you might have several if you talk about 90 locations, but that's how it works. So you'll have to pay attention to the contact us under your login and for you to find out specifically who it is.
And that will still apply once everything transitions to the group billing in January?
Probably, because I think probably.
Yeah, once you're logged into that rendering provider ID, it'll go straight to your provider rep. So whatever territory you're in, it'll go to that field rep.
Anyone else?
I'm just piggybacking off of what she said because we're a hospice provider and we're all over the state of Georgia. So as far as the field rep, basically I'm dealing with every single field rep. That's what I'm hearing.
It depends. What they said was when you sign in, whatever your sign-in log is, that will go directly to one. If you have multiple locations and multiple logins, you're probably going to be dealing with lots of field reps. And part of the reason why we do that is because we're not going to send somebody from Roan to Hahira. You know what I mean? Or to Cairo. So they're kind of located throughout the state so that they can get to you if they need to.
So basically for us, it will be everybody because we have more than one rendering provider number.
But the field reps, they talk to each other. They meet. They can usually connect with another field rep that's in your region that make them aware of an issue you are experiencing and may be experiencing with other field reps and other agencies. So just let one know, and they may be able to talk to your other field reps on your behalf. But you got to tell them what's going on.
And they also talk to us periodically, y'all.
Monthly.
So we have meetings where we interact with the provider field reps to make sure that common issues that are going out amongst you guys we're aware of. They talk about y'all. I didn't want to tell you, but I know y'all talk about me.
I know.
I'm so old, I don't care anymore.
I saw somebody over here. When that's the person.
Nope, nothing. Anybody else? Oh, one in the back. Come on, y'all.
Sorry. For years,
it was in the Part 2 health check, EPDST, whatever the heck it's called. There were in the back, there were samples of the old paper CMS 1500 form of here's what a claim should look like, and there were like 4 or 5. Here's a preventive visit, here's a preventive visit with immunizations, here's a preventive visit with a sick visit on the same day. I can't find those. Have they been moved or are they disappeared?
You've been here as long as me. You going back? You going way back.
It's still there.
It may not be in the Part 2. It may, Danny. Okay, might be in the billing manual.
They've removed it. However, we
Could be
do have a
electronic.
breakdown where they typed it in the manual. So if you do Control F and type 992 and keep hitting enter, as you move down, you'll see it, but it's broken out, but it's typed. The form is no longer there, but the examples are still in the manual. I'll show it to you. I'll pull it up on my phone. Anyone else with a question?
All right, going once. Going
Oh, it's,
twice.
it's time. We're at time.
It's time.
Thank you, everybody.
On me anyway.
Anything you can think about on your ride home, you got my email address.
That's great. You did a great job. You did a great job.
Go meet Dave. I'll meet him another time.
It's good to see
I
you.
started to blow up because remember I'm the one that do our diagnostic code, healthcare procedure codes, all that.
I
quarterly.
remember that. I
And
remember
my